Jonathan, thanks so much for being with us. Can you tell our viewers a bit about how the nursing shortage arose and how it's affecting the community?
Well, it started about a month and a half ago when we began to see the declination of nurses that come into the community. So it really impacted everything, the service delivery at the nursing station. Because they began to operate on emergencies mode only. That meaning that only people with a serious situation were the ones that got to be seen by the nurses, and all the other general care was put aside, like appointments or walk-ins, and even blood work. So it really impacted the whole operations of the nursing station.
Kashechewan's pretty far north. Where are residents being forced to go to try and access some of these services?
Right now, the general client, they're just here at home. They don't. They're not being sent out. Only emergency cases are being sent out, either medevac or put on the patient charter plane for those that have appointments in Timmins or Most Factory or Kingston.
Now, we understand you've been in regular communication with Indigenous Services Canada about the situation. Can you give us an update on where those talks are at?
It's progressing. We've made a lot of headways since this weekend. We're working with our regional health authority now, working with a nursing agency, other than what ISK have an agreement with a national organization. Now we're going to start seeing nurses in our community in the days or weeks to come. And that will complement the existing rotation that the government or ISK provides on 2-week basis. So it will complement their nurses in regards to that agreement. And WAHA, or Winnebago Health Authority, are taking a role on that, because they have to sign a contribution agreement for that service. And they have a contract with this particular nursing agency that we approached. And we expect one nurse by tomorrow. And then the nurses will start rolling in. We're going to have a nurse practitioner too under that agreement, that contract. So I'd say in about a month, things will stabilize if things go well. And it's not fast enough. You know, my nurses here, our nurses here at the nursing station at this moment, I went to see, I was talking to them yesterday, and they're getting very tired.
I bet.
They've been here for 1 week, and they've been very busy, though they're only operating under emergency mode only, because the number of clients that need emergency care come in every day. And even medevacs, there's even 1 or 2 medevacs a day. So the situation is very serious, and like I said, our nurses are getting very tired. Sleepless nights, you know, though they try to rotate. And with that number of nurses on the floor, it's just, I can understand why they're so tired, because of the number of cases that they're dealing with on a daily basis.
Earlier in the week, Indigenous Services Canada had told us that some of the nurses in your community have experienced violence on the job. Can you tell us a bit more about that?
There are maybe situations where somebody may be violent because they're under the influence of alcohol or drugs. And in a situation like this, I was advised that there was a situation one night and but that's the challenge of having just for a number of only a limited number of nurses in the nursing station. And some people are like I said, they may be under the influence of alcohol or other prohibited substances. So that's what happened, and we have security here. They took control of the situation, and that's what I'm concerned about. We've always been concerned about is the well-being of our nurses, and so they sent in some security support for a few days, maybe to run for 2 weeks to support our security at the moment. We had a festival here last week, and it was a very community festival, and a lot of our staff took part in on that festival, and I know in a few cases security weren't there because they wanted to take part in the community festival. So it's not something that's normal, everyday thing. Like we have a steady security personnel that I am very proud of in what they do and the service that they provide.
Jonathan, we'll have to leave it there, but we hope the situation improves in the community soon. Appreciate you taking some time for us.
Well, thank you very much for having me.